Pulmonary embolism is a blood clot that prevents blood from flowing through your veins. Your veins are called an embolus, and it prevents the blood. It's a blood clot that blocks an artery in your lungs, and it can be a life-threatening problem. Normally inside your body, your blood is liquid. It flows throughout. Sometimes something does go wrong and with the clotting system, and blood clots form where they're not supposed to. They normally form inside your leg veins. They can form from you sitting for long periods of time, or if you've previously injured your leg, but the actual cause of how they happen is not known. The clots tend to break into tiny little pieces and then travel throughout your bloodstream. Sometimes they'll block a blood vessel and get stuck. A pulmonary embolism is a clot that comes from the lungs or travels to the lungs. If your blood is flowing very slowly throughout the veins, it makes it easier for blood clots to form. Or if you're taking any medicines for any diseases, you might have a blood clot. You might get blood clots if you are a smoker, if you're not active, if you have surgery, a disability, or an illness, if you have cancer or heart disease, if you have broken your leg, or if you've broken your hip. Also, if you've had a heart attack or a stroke, or if you sit for long periods of time. Also, women who use birth control films, all of those can cause a pulmonary embolism to happen. The symptoms for a pulmonary embolism may include chest pain, especially when you take a deep breath. You can have a shortness of breath, you become dizzy, you could have a high fever, you could cough up blood, you have lightheaded or you feel like fainting, if your legs begin to swell, or if you're feeling anxious. Those are all symptoms of a pulmonary embolism. A pulmonary embolism is analyzed through a bunch of different tests that the doctors will do. They'll ask you your medical history, and then they'll perform the test and figure out what damage has already been done, if has any. Maybe some of the tests they can perform is an X-ray, a CT scan. They might do an electrocardiogram to measure your heart rate. They might measure the level of oxygen inside of your blood. They might do a lung scan that shows a picture of how the blood is flowing throughout your lungs. Also, they could do an ultrasound scan on your legs to see if there's any blood clots. Normally, if you do have a blood clot that leads to pulmonary embolism, you will have to go to the hospital. Your treatment depends on what your lab results come back, and how sick you are, and where the blood clots actually are. Most of the time, the pulmonary embolism is treated with blood thinners. Those medicines will help stop the blood from clotting, and it'll help it from breaking off and becoming bigger. They also prevent the blood clots from forming in the first place. If you're in the hospital, you'll take the blood thinner through an IV or through an injection. After you leave, you will probably continue to take the blood thinners. It'll probably be a medicine, a pill. You may need another medicine to help dissolve the blood clots that you already have. You must be watched very carefully in case there's too much bleeding while you're taking this extra medicine. If you are very sick, they might perform surgery to remove the clot from your artery. If they don't remove it, then you could possibly die. The surgery should improve your blood flow throughout your lungs. If you continue to have blood clots, they might put in through surgery a plastic filter in your abdominal artery to filter the blood before it gets to the heart and prevent any clots from getting to your lungs. How long the pulmonary affects you depends on the size of the clot, how easily the medicine dissolves the clot, or why the clot even formed in the first place. Many of the symptoms will get better with the treatment, but you may have less energy, no stamina for the next few weeks. Most people will take blood thinners for 3 to 6 months. Most people have a high risk of getting blood clots, can continue to take the medicine, the blood thinners, for the rest of their life. You should follow the treatment prescribed to you by your doctor. Understand how the medicine works in the instructions. Make sure that your doctor checks to make sure that the medicine that they have given you, the blood thinners, is even working. Avoid taking any pain medicine such as ibuprofen or naproxens. These medicines increase the chance of you bleeding. Also, when you go to the doctors, inform them of all the medicine you're taking, whether they're prescribed or not. Normally, blood thinners will make you bleed easily, so when you're doing outdoor chores or indoor chores, make sure you wear gloves. Don't walk around barefoot. You could step on something and cause yourself to bleed. Don't smoke. If your legs start to swell, notice that. Put your legs up or wear special stockings to help prevent the blood clots from forming in your legs. Also, ask your doctor when it's ready for you to go back to a regular exercise program. You can prevent blood clots from forming by being on a regular exercise program. If you're recovering from surgery, ask your doctor what you could do, or your doctor might prescribe to you blood thinners from not getting blood clots. Also, if you travel a long distance, be sure to stand up and walk. Make sure that you don't sit with your legs crisscross. Like every hour, get up, move, stretch out your legs. Unless your doctor gives you a limit on how many liquids you can have, drink tons of water, liquids. If you know you're going to have surgery, you can ask your doctor what you can do to prevent blood clots from happening. Don't smoke. Avoid wearing anything on your legs that restricts the blood flow throughout them.